Next from Springfield, we attend a press conference and hear from those opposed to the consumer sale of fireworks in Illinois. This runs about 35 minutes.
Okay, good afternoon. Thank you for coming today. My name is Margaret Vaughn. I am the Government Affairs Director for the Illinois Fire Safety Alliance, as well as the Illinois Firefighters Association. The Illinois Fire Safety Alliance has been around for over 25 years. They put on a camp every summer for burn survivors, Camp IME. They also do a lot of programs with families and burn survivors as far as them re-entering the real world, because that can be very difficult. The reason we're here today is Sunday starts Burn Awareness Week, and we wanted to make you aware of some of the public policy issues that we think are important to prevent burn injuries. Burn injuries are very, very much preventable, but there has to be the correct policies in place. One of the big topics today is the legalization of consumer fireworks at the retail sale. There has been talk this session of introducing legislation to legalize that, to increase state revenues. We feel that, however, any increased revenue would be offset by increased medical calls to first responders that would be paid for by taxpayers' money, not to mention the Medicaid claims for the burn injury victims and property damage. And you really can't put a cost on human suffering. So I have Chief Steve Ivanelli. He is the president of the Illinois Fire Services Association. He's going to touch base on a couple more of those points.
Good afternoon. My name is Steve Ivanelli, and I'm the president of the Illinois Fire Services Association. That association is made up of 13 organizations throughout the state of Illinois that encompasses everything from the Chicago Fire Department to the small volunteer fire departments throughout the state, along with the AFFI and the Illinois Fire Chiefs Association. And today we're going to talk a little bit about our feelings regarding the possibility of the legalization of consumer fireworks. In 2010, what most people remember is there was a threat, an IED threat in New York in Times Square, where they found an explosive device inside of an SUV. And then in 2013, we were all aware of the Boston Marathon bombings. It turned out that both of those bombs were made out of pressure cookers, and the explosive device that was used were M80 fireworks that were both purchased at the same fireworks store in New Hampshire. So these are consumer products that they can purchase anywhere, and they're being used now as terrorist threats. So that is one of the reasons why we feel that the consumer fireworks issue is so important, why we're so against it. Another issue is that such states as Missouri, since they've legalized fireworks, have seen a 400% increase in injuries due to fireworks. The Consumer Product Safety Division in 2013 reported 11,400 injuries surrounding fireworks, and that's a 31% increase from the prior year. Also, along with those injuries, the majority of those injuries were sustained by children between the age of 5 years old and 10 and 14 years old. So these are issues that we feel are very important, that we feel that are reasons why whatever the revenue that the fireworks may bring in, that it will not offset the damage done to human beings and to property as well. So we feel that we'd like to see this not happen and keep fireworks in the hands of those that know how to use them. Thank you.
From the medical perspective, we have Dr. Mike, I'm going to pronounce your name right, Neumeister, and he is the director of surgery at SIU School of Medicine, and he is also head of the burn unit at Memorial. The doctor has a different perspective because he is seeing the burn victims directly and the impact that these fireworks have, mostly on children.
Sure, thanks very much. Burn awareness, what a great initiative. I think all of us have been burned at some point in our life, maybe on the stove, maybe with a little iron. Imagine a little burn this big, how much it hurts. Now imagine a child that's burned 10, 20, 30, or 40% of his total body surface area burn. It's amazingly painful. The childs are scarred for life. We still, in the medical profession, don't know how to handle the scars with burns. But that's one of the things that's after the fact. What we see initially is the length of stay in the hospitals is enormous, sometimes for months, even up to a year. In fact, we just had a child that was a 90% burn, survived, but almost a year in our burn unit. Painful dressing changes. There's a lot of pain medication. There's a lot of things that involve a multidisciplinary approach. A very difficult problem. They lose body parts from the burns. They lose their nose, their cartilage, eyelids. It becomes a reconstructive nightmare at times. And again, they're scarred for life, not only physically, but mentally as well. Now couple that with fireworks, where you actually have an explosive component to that, where they've lost a thumb, a hand, a finger, a toe, or something else in their body. They can no longer play the way the other kids can play. If those have lost hands, they can't hold their hands with their mother or their father anymore. This is all preventable. Burns take away a majority part of your social life. They take away all of what we all deserve in our rights in life. We shouldn't have to deal with these kind of burns. So we have medical centers to try to care for the patients. We have infection control to try to prevent infections, which is a major part of burns. Skin protects us. It protects us from infection, from trauma. It protects us from losing all the various fluids and electrolytes in our body. People become very sick. If we can prevent it, we will prevent a lot of damage psychologically and physically to kids and adults alike. So thanks very much.
The doctor has to go to surgery, so we don't want to keep him. Next, we have Tom Hughes. He is the Executive Director of the Illinois Public Health Association.
Thank you, Margaret. Good morning. Again, my name is Tom Hughes. I am the Executive Director of the Illinois Public Health Association. Our association is the largest and the oldest public health association in Illinois. We have more than 7,000 members across the state. And I'm pleased to be here today representing the association and our members, many of whom are nurses, other health professionals. Margaret, we're here to stand in support of the Alliance to make sure that public policy protects the citizens of Illinois and make sure that the citizens of Illinois understand how the impact of burns and the injuries to children are caused by these devices. So my job with the association, Margaret, will be to mobilize our membership, to work strongly with the Alliance on good public policy, and to help prevent the injuries to children and the residents of Illinois. So thank you for inviting me to be here today. And also to the chiefs, thank you so much for the work that you do to protect the public and all Illinois residents. Thank you so much.
From the Chicago Fire Department, we have Joe Akasava. He's the Chicago Fire Department Deputy District Chief.
As Margaret mentioned, my name is Joe Akasava. I'm the Coordinator of Fire Awareness for Chicago Fire Department. Not only a firefighter, but I'm also a paramedic. Over my many years of service, I've seen the effects of fireworks to those who are using these devices. Without the proper supervision, injuries can range from burns to loss of fingers, hands, blindness, and even worse. While we at the Chicago Fire Department understand the need to enhance revenue in our state, we feel that relaxing the law to permit the sale and use of fireworks is a mistake. They can have a high cost of injuries and possibly death. In Chicago, the trend has been to tighten laws surrounding the use of pyrotechnic devices, including devices that some people don't see as fireworks like sparklers. They are now included in the Chicago fireworks ban, and we believe that the inclusion of sparklers in the ban has saved some of our young people from catastrophic burns. These sparklers, which many think are harmless, can burn up to 2,000 degrees and can set clothing on fire and create third-degree burns to a child's limb or torso. Any move to relax laws banning these sales or the use of fireworks for the purpose of creating a new tax source is, in our opinion, putting a cheap price tag on the safety of our citizens, in particular the youngest and most vulnerable. It is the job of state government to protect our children, not put them in harm's way in the name of financial expediency. I would suggest that any lawmaker who thinks legalization of fireworks and similar devices is a good idea should spend time visiting the emergency rooms on the July 4th holiday and see firsthand what can happen when fireworks are the source of traumatic emergencies. Then imagine that as his or her child being treated. Because other states have chosen a different path on this issue of fireworks, that is no excuse or reason for Illinois to lower the bar on safety for our kids. While the idea of allowing and taxing these devices may be well-intentioned, I can tell you as a public safety expert, It's a terrible idea with the potential to ruin many lives. The Chicago Fire Department joins our fire safety partners in asking that this proposed measure be stopped now.
Next, I have Mike Fagola, who is the former president of the Illinois Fire Safety Alliance and the deputy chief for the city of Bartlett.
Good afternoon. While the IFSA, the Illinois Fire Safety Alliance, is known best for its burn camp program, the primary mission is actually to put that burn camp out of business so that hopefully next year we don't have any burn kids to attend. That's ultimately our goal. Probably not very realistic, but every chance we get, we look for efforts to reduce injuries to fire and burns. Each year, we look at the kids that come to camp and find out what the causes are. And unfortunately, it can be very difficult at times to reduce where some of those injuries come from. However, the Illinois Fire Safety Alliance over the last probably 10 years has had a real influence on fireworks injuries. We were part of the group that got together about 10 years ago now to rewrite the Illinois law. Illinois fireworks laws go back to 1920s when the Illinois Fireworks Use Act was developed. This early law was developed to control the use of explosives. The law remained largely in effect until 2005 when the Illinois Fire Service, the police departments, and the fireworks industry got together to strengthen the law. Let me tell you that again. Public safety worked with the fireworks industry to strengthen the Illinois laws. Today, that law still stands strong and has made a difference. We have not had a single child attend burn camp since that law was put in place in 2005, where we used to see kids every year come back over and over again. The only challenges have come from those trying to develop a new revenue source. Once we explain, however, typically to the person looking to generate that new revenue source, and we tell them about how it'll affect emergency first responders, the insurance claims, people's homes, and of course, people's lives. Typically, they withdrew their intent to go ahead and generate a new revenue source. In addition to the cost of fires and burn injuries are devastating to kids. You see, 40% of the injuries out there from fireworks are kids under the age of 14. And children under the age of 5 have the highest per capita injury rate. Today we'll hear from many causes for burn injuries, scalds, and other ways. Some of the causes are easier than others to reduce. Fireworks-related injuries and deaths in Illinois are on a downslide because of the current law. Illinois is a leader in this country in this area. Fireworks injuries are increasing nationally, according to the Consumer Product Safety Commission, by over 30%. Yet Illinois laws are going down. Missouri decided to legalize fireworks and saw an increase of 400% in injuries. On behalf of the Illinois Fire Safety Alliance, we urge everyone to understand the dangers associated with fireworks and leave fireworks to the professionals. We're not saying that you still can't have a good time on the 4th of July and celebrate at great times, but leave it to the Illinois professionals. One of the other issues that we see with fireworks is getting quality standards. Interestingly, in a recent test from the Consumer Product Safety Commission and the U.S. Customs Borders Patrol staff, over 30% of the imported fireworks were non-compliant with our federal regulations. That means that substandard fireworks even are coming into our country, 30%. Violators must often overlook this report, of course, and failure to meet the burn time requirements. So these can be, we know the inherent problems with fireworks because they're loud enough, they make an impact. We can see where the problem comes in. As the doctor says, in addition to a burn, you also have an explosion that causes further. So there's a problem at many facets with burn injuries. And again, on behalf of the Illinois Fire Safety Alliance and all of our partners, we ask people to be safe and leave fireworks to the professionals. Thank you.
Next, we have Dave Scurry. He is a burn survivor himself. For over 10 years, he volunteered at the camp for the burn survivors, as well as worked with children at Loyola's burn unit, and he also founded Tragedy to Triumph Foundation, which provides scholarships to Illinois burn survivors. And several of them have gone on to study their nursing careers, and they are actually nurses in burn units now. So that's very inspiring.
Good afternoon, everyone. My name is Gabe Sheree, and I'm proud to say I'm a burn survivor now 15 years. I have volunteered at the Children's Burn Camp run by the IFSA for 15 years. I've also volunteered at Olah Hospital for 10 years, going in to talk to patients and their families when they go through such a devastating burn injury. I've met hundreds of just wonderful and amazing children over my 15 years. And I'd like to share what they go through. We'll start with their families, their moms, their dads. When they see that child in the burn unit, sometimes they don't know if that child's going to live or if that child may even die. If that child's going to be scarred, if they're going to lose an eye, a finger, maybe a hand, or maybe worse. And for that child, they don't know what's going to happen to them. It's the most excruciating pain you could imagine if you've been burned. A child has to go in to get its bandages changed every day, sometimes twice a day. They go to this room, it's called a tub room. They have to go in there, and sure, they give them some medication for the pain, but all it does is take the edge off the pain. And you hear these kids in there, and these kids have to lay on a table or sit in a tub while these wonderful nurses, who I call angels, go and scrub and debride the dead skin. They have to take that dead skin off, because if they don't, that new skin underneath isn't going to be growing. So they need to hurt and cause pain to that person who's in that burn unit in order to make them better. And once these kids go through that debriding process and these bandages for many days, sometimes weeks, now they're ready to go home. Maybe some of them need to stay longer and have skin grafts, where they take skin from a good part of your body and place it over the injury. Now they cause them another wound that exposes all the nerve endings. When that child goes home, that child has to learn to live with the new way he is or she is. Will I be accepted in back to school? What will my friends think of me? What are they going to look at me and see the scars? It takes a lot. These young children don't have the coping skills many adults have. They have to learn from that. So it's terrible when you see a child, when an adult, anybody in the burn unit. My first year at camp, I was in pressure garments covered up to make my skin heal quicker. And there was a 10-year-old boy came up to me, and this 10-year-old boy said, "Mr. Sheree, you don't need to cover up your burns here." He says, "We're all the same here. This is a safe place for these kids 1 week out of the year. But the other 51 weeks a year, they have to go back to the real world to be made fun of, to accept, and to try to learn coping skills to deal what has happened to them." So I ask everyone in Illinois, all the parents out there, to please keep your children safe, because we don't need any unnecessary pain brought to our children. So it's our responsibility as adults to look over the future, our children. I thank you very much.
Thank you. It's not only the fire service that has the same position with opposing the legalization of fireworks. The law enforcement does too. We have the former head of the Illinois Association of Chiefs of Police with us today, Eric Smith, who is also the chief of Sherman. As we said earlier, a lot of times the explosives are used to harm others. They get in, sometimes people call us that say that we're not patriotic. Well, some of the hands that these explosives are getting in are people that are not patriotic at all, and they definitely want to injure us. So, Eric, if you can please come up.
Thank you, Margaret. As Margaret said, I'm the chief in Sherman Police Department and a past president of the Illinois Chiefs Association. The police chiefs stand together with the fire association chiefs in opposing any of this fireworks legislation or opening it up more broadly. The police chiefs agree that expanding the sale of fireworks would result in more injuries, which runs counter to our commitment to work for safer communities. In addition to accidental injuries, law enforcement has already seen explosives used to harm or threaten others, as the president of the Fire Association talked about earlier, and we would not support anything which would make access to these easier. Thank you.
Another type of burn we wanted to make you aware of is scalds, the second most common type of burn injury, but they are also highly preventable. Every year there's 3,800 injuries and 34 deaths, and unfortunately the majority of those victims are older adults and children under the age of 5. We have Dave Dirtz with us today from the Illinois Plumbing Inspectors Association, and he's also the president of the South Suburban Building Officials Association.
Thank you, Margaret. My name is David Dirtz. Scalding is a real issue in households. Hot water thermostats in the water heater are not reliable enough to prevent water from reaching temperatures of scalding, nor do they prevent the bacteria that can develop inside a water heater. A simple device, a thermostatic mixing valve, that mixes the hot water coming out of the water heater and the cold water to give a desired temperature out to the home. That will help to prevent scalding of children, who account for approximately 25% of all burn victims are from household-related scalds. Thank you.
Thank you, and those devices are already required in all hospitals and nursing homes. So I appreciate everyone coming out today. Just want to remind you that the majority of these injuries, over 50%, are children under the age of 19. Per capita, the highest injury rate is children under the age of 5, and we don't feel that that is the way to balance the Illinois budget on their injuries. Without further ado, if there's any questions, we also have Ken Fuston here. He's the chief from the city of Springfield, fire chief, and Chris Richmond. He's the Springfield fire marshal. So if anyone has any questions, we'd be happy to answer them. Thank you.
Margaret, I have a question for Steve, my own friend and buddy here, Ivan Ellie. Yes. Let's talk about, is there going to be any legislation introduced to require new home construction to have water sprinklers?
Right now, the legislation for sprinkler is on hold, but we're still active in pursuing the sprinkler legislation for new construction only. And we do have more and more municipalities doing it at a local level on a one-by-one basis. But the Fire Services Association is still in strong support of the sprinkler initiative, and we will be pushing forward again this year. Answer your question? Thank you.
You know, the worst parent in this room would not give children matches or a lighter or kerosene to play with. Why, what's the attitude with fireworks where people don't quite get that, or how is it such that they are accessible, much more so apparently than, as I said, matches and a lighter?
Well, it's interesting that Indiana, where they are legal, over 60% of the burns to children occur when adults are present. I mean, I think the bottom line is people have to realize that these are explosives and that they should be left in the hands of trained professionals. We're not talking about glow snakes and stuff like that. These fireworks, these are the type that, again, were purchased to be used in the bombings out east by the terrorists. So these are fireworks that need to be, in the hands of the trained professionals. I don't know, Mike, if you want to allude any more.
Could you incorporate in your answer, what are we talking about when we say fireworks? Are they different classes? Are you talking about, Margaret said not the snakes, but are we talking about sparklers? Are we talking about bottle rockets? Where do we draw the line if we're going to allow something?
If you think about the dangerous fireworks, it's the things that go boom and the things that go in the air. Sparklers, the glow snakes, those are considered novelty items, and that's on a different area within the state laws. So fireworks, if you think of things that go up in the air or blow up, that's basically the items that we're talking about. Roman candles, firecrackers, those type of items. An interesting question before about why do people use fireworks when there's such a big chance of injuring someone. First of all, I don't think that there's a parent out there that does that thinking they're going to injure a child. I'd like to think that. There's an issue with fire safety in general, whether it's fire sprinklers or no matter what it is that it won't happen to me. We respond to tens of thousands, hundreds of thousands of incidents per year in the fire service that the people that it'll never happen to them. We always think that we'll be a little bit safer, that bad things happen to people who do careless things, and nothing could be farther from the truth. If you don't have a carbon monoxide detector, you're at risk for carbon monoxide. If you don't have a smoke detector, you're at risk for not having the early detection to tell you to get out of the home. Yet, 50% of the homes roughly in this country with smoke detectors don't have working batteries in them. That just shows the complacency. That's why we're here today. This is Burn Prevention Week. We're here to educate the public. We think that the more we tell people, and hopefully we get to the right people to influence them to make good decisions for themselves and their families. We're not against fireworks. This isn't a unconstitutional where we don't want to celebrate our country's heritage and all that. It's leave it to the fireworks professionals and be safe. Don't risk it, because with fireworks in general, when things go bad, they go really bad, really fast. So I hope that answers.
We have good numbers as far as we've done a number of things over the last decade or 20 years. Are we making progress? Have we cut down on the number of people who've been injured or burned in general, not just from fireworks? If we look at where we are today versus the 1970s, perhaps?
Well, we can tell you nationally, the rate was going down of the fireworks injuries. However, a lot in the other states, they got kind of lax. A lot of the other states are pretty lax with their laws. New York is not one of them. New York actually has stricter laws than we do. But last year, there was a 30% spike between 2013 and 2012 in fireworks injuries. So that was huge. And a lot of it is, people were getting kind of lax and thinking, it's no big deal. The other thing, to answer your question, is a lot of these injuries are not necessarily the people that are using the fireworks. A lot of it is innocent bystanders. I know that, Chris, you had a story about the...
Sure. Chris Richmond, I'm the city fire marshal here in City of Springfield. Just this last July, I personally witnessed an incident. I was at a permitted fireworks display. Inspecting that fireworks display, a large crowd had gathered, and a private property adjacent to our display area had an unpermitted display that spontaneously began by the private owner. They clearly didn't have a permit, didn't know what they were doing. They had purchased over-the-counter fireworks. The tubes that they used fell over toward the crowd and injured several people in the crowd. Minor burn injuries are how they were characterized. But we had a number of injuries from that. Unfortunately, this is all too typical of how the scenario plays out on these kinds of fireworks.
There was also a case in Missouri a couple of years ago where a 4-year-old girl was sitting on a neighbor's porch. The neighbors were the ones with the fireworks. The bottle rock tipped over, hit her in the head, and she was killed. So again, a lot of times unfortunately, it's the innocent bystanders. Same thing with the people with the property damage. It's the neighbor's house that catches on fire and damaged.
You said there was a 400% increase in Missouri. What are the actual numbers of that increase from what to what?
We don't have them with it, but we can get them to you.
And you also mentioned talk this session. Where's the talk coming from to legalize fireworks?
I know there was a bill last year to legalize them that was introduced in the House, and now there's some talk this year of possibly introducing it in the Senate. So it has not been introduced yet.